Unfortunately, the United States public healthcare system has fallen behind other developed nations in the ability to detect and stop the spread of infectious disease. For the most part, our system is unorganized, non-uniform, and cost-driven. In a November 2010 white paper from the CDC, HICPAC, and IDSA, a plan of action outlined the elimination of healthcare-associated infections, many of which are antibiotic resistant. One of the outlined 4 pillars of HAI elimination was data for action. Unfortunately, we have not yet been able to achieve this. When data is available, it is all too often highly adjusted, and its access is often delayed by over a year. Risk adjustment must be done with caution. One needs to make sure that adjustments are applied to circumstances which cannot be mitigated and not used to normalize deviance. First, risk adjustment for community levels of MRSA is problematic, especially when a facility does not implement universal MRSA screening and intervention upon admission. If community rates are too low to warrant implementation of this strategy, then they are too low to be risk adjusted. Second, risk adjustment for COVID-19 patients with MRSA and other antibiotic-resistant organisms are also problematic. One is only affected if exposed to the resistant organism. During the pandemic, MRSA infections in the private sector rose 17% above their 2015 baseline. In contradistinction, the Veterans Administration saw an 84% decrease in MRSA infections since 2010, a decrease which was maintained through fiscal year 2022. Third, requiring that only current inpatients who contract COVID-19 14 days or more after admission be counted as hospital onset will capture few patients. One needs to consider that Omicron has an incubation period of approximately 3 days and that the average length of hospital stay is 4.6 days. Not tracking patient acquisitions of COVID-19 places both patients at risk and masks the need for mitigation strategies. Finally, strategies need to be based on the characteristic of the pathogen, not on the political environment. Relaxing school guidance when the United States has almost 500 deaths a day, along with 1 in 8 patients developing long COVID, is problematic, especially when there is a teacher and bus driver shortage. It would make more sense to stay the course, especially when a new formulated bivalent booster to BA.5 is just weeks away. Thank you.